This week, first of all, last week on Saturday, we finally got numbers from the Regional Medical Officer of Health. If you recall, last week I spoke about an outbreak in one of our long-term care facilities and retirement residents on Mountainview, and the Medical Officer of Health had to get clarification from the province due to privacy, and unfortunately, it wasn't good news. We had an outbreak at the Mountainview Residence, and the numbers were 63 residents and 18 staff contacted the COVID-19 virus. And unfortunately, we had 9 deaths. I believe they were all residents. So that is now released, it's public, and that's one of the reasons why Halton Hills, we were all wondering, why are the numbers higher than, almost the same as Oakville is, which is a much larger population. So it's very unfortunate, and our hearts go out to the families and loved ones that are impacted by the deaths. And we want a speedy recovery for all those other people that are suffering from it. But it seems to be a case that's gone throughout the province in a lot of long-term care facilities.
Let's talk about that a little bit more. So now that you have those numbers, what is it that you and council are trying to do to, I guess, alleviate that situation? Is there something that you can do?
Not particularly, because the health department is handled by Halton Region. So they've been working very closely with the long-term care residents, along with the local hospital. I spoke to the local hospital earlier in the week, and they assured me that they are working with the long-term care residents. But what I can tell you is that we have about 24, I believe, senior residents, long-term care in the town of Halton Hills. Like when I say senior residents, just entitled, just purely senior residents, not on any sort of provincial plan or anything like that. And we've only had 2 outbreaks out of the 24. And that's something, Melissa, that during the ice storm of 2013, that was one of the things we learned from it, because we sent our fire department out to call all the senior residents to make sure everybody was okay. So when we had the COVID-19 emergency plan, we are using our fire department again to contact all of our long-term facilities, senior facilities in the town. So that's one thing we're doing. And the other thing is Dr. Nadia Alum, myself, and a few others, we've collected a community PPE drive, if you will. And it's been really, it's unbelievable. We've had nail salons, dentists, donating their masks, donating their gloves. We've had over 90 families sewing gowns, caps, etc. And now Superior Glove, they retooled and they made over thousands of gloves that they donated. That's going to the hospitals, going to local doctors. And now just yesterday, I received the first 160 shields that that's very important. That's also going to be distributed around. And these are going to some go in the long-term care facilities, local family doctors, midwives. They're going to pharmacies, as well as to the hospitals. So the community's really been stepping up big time in local industry.
So let's change gears a little bit. I suppose now Halton Hills is now dealing with some pollution issues, if you will, that some other communities in Halton have experienced. You've experienced that as well. So talk about I guess the proactive plan that the town is doing to address those issues.
Yeah, I know the pollution you're talking about. More and more people are wearing masks, wearing gloves when they go shopping, etc. And unfortunately, and it's hard to believe, I have to remind people that this isn't very sanitary. I mean, this should be common sense, but we've had concerns in our parks on just discarding their gloves and masks. And there's countless stories everywhere, just not in Halton Hills, about grocery stores where people are discarding their gloves in the carts, and they're discarding them in in the parking lots. Well, we have a bylaw in place that you can get a $200 fine if you get caught doing this. So we did a press release, and we want the public to be aware, and we're going to be enforcing this. There won't be any second questions like, oh, gee, I didn't know. No, people, you know better than that. It's littering to begin with, but it's unsanitary. And even if you see somebody, you don't have to confront them. Just take a picture of their license plate number, and we'll follow it up. So that's one thing that we can follow. Plus, if you see the driver. But we want to take this one serious because this is a health hazard.
It certainly is. Well, I want to thank you so much for taking the time to speak with us today to give us this weekly update, and we look forward to next week's update as well.
Yep. Have a great day. Stay safe.